Alright, let's talk about COVID-19. Actually, let's talk about what COVID-19 is not. COVID-19 is not a hoax, it is not the flu, and it is not a respiratory disease, okay? It affects your lungs, but that's because it is a vascular disease that attacks the capillaries in the lungs. But not just in the lungs, it can actually spread to other organ tissues, most commonly the brain, the heart, and the kidneys. Now, there have been a handful of cases that have actually been demonstrated to have started in the brain and have bypassed the lungs entirely. So, you're getting a slew of symptoms from the ones we've talked about, like the coughing, shortness of breath, the normal classic symptoms, but also strokes and blood clots and psychotic events and heart issues. I mean, the list goes on and on and on forever. In kids, it can cause multi-system inflammatory syndrome, which is widespread organ inflammation. Again, this is likely connected to the fact that it's attacking the capillaries. Thankfully, the MIS-C is not typically fatal, but we also don't know the long-term ramifications of what happens in 10 years if you contract this virus as a kid. So I am deeply concerned by the ongoing dialogue that COVID-19 is just the flu, and folks are having COVID parties, they want to get it and get it over with, and this is just an absolutely brutally unwise thing to be doing. So first of all, most studies on the antibody result of COVID have returned the fact that within about 10 weeks or less, you have lost all of your antibodies. And for some folks, especially the folks that had mild cases, they never really produced a significant amount to begin with. So this means folks that have had COVID-19 are not protected from a second infection. So that's big. That's a big deal. That's not typical for most viruses that we deal with. This raises some concerns for a vaccine. I will say there's been some promising research there. There are some hopes that they're going to be able to develop a vaccine that will create a more robust immune response to create a more long-lived longevity for the antibodies. However, right now it's inconclusive. It's promising, it's hope there, but even if it turns out to be 100% effective, it's going to be a year at least before it is widely available. So we really cannot bank on herd immunity because there's no proof that there's going to be herd immunity from natural infection. We cannot bank on a vaccine because there's just too new. There's not going to be one yet if they're able to make one at all. So the response to COVID-19 requires a societal shift. Okay, so one big thing is masks. Obviously, we need to be wearing masks. This is a really crucial tool. It is very important. There are no significant side effects to wearing masks, especially for a short amount of time. Now, I do want to point out here that it is real that some folks cannot wear a mask for some reason. It is real that some folks cannot tolerate the discomfort for long periods of time, especially if they're outside, especially for kids. So we cannot take masks and throw them at this problem as if they are a magic band-aid that are going to make the pandemic just go away forever, because that is not the case. That's not what we're dealing with here. They're useful, they're essential, but that does not remove the necessity of closing non-essential businesses. So, and even the businesses that are essential, even the places that we need to keep open, we need to be reducing staff hours so that the 16-year-old kid who is working at the grocery store who did not sign up to have a mask on their face for 8+ hours a day is not in the situation where they're so uncomfortable, human error takes over and they start fidgeting with the mask, rendering them useless, okay? So we cannot ignore the human condition. We cannot pretend that saying masks work means that everyone's just going to wear them forever and we can go back to normal. There is no normal, folks. Normal is done. Normal is gone. Normal wasn't that great to begin with, but we ain't going back to that, not at least anytime soon. So we need to be modifying store hours, and not in terms of how long they're open, but the staff hours. So you might, if you want your store to be open for 16 hours, that might mean you need 16 different people for 1-hour shifts. And the thing is, we need to be paying those people as if they were working full-time. So you're not going to be able to mask your way out of the reality that we need more stimulus checks for the people. We need a bailout for the people in order to really significantly contain this virus, which in the United States right now is wildly uncontained, okay? It's getting worse every single day. We're hitting new case records all the time. Our testing is still somewhat inefficient. We're still not testing or doing contact tracing nearly as much as we should be. So there are a lot of problems right now, and the biggest thing that we can do is wear a mask if you have to be in public, and don't be in public if you don't have to be. So we gotta close a lot of stuff back down. The biggest things are obviously restaurants, so anything where your patrons cannot wear a mask should never have been opened to begin with. Those never should have opened up. So those need to be closed immediately, or at least back to, curbside contactless service. So any person you interact with is still wearing a mask, they're not eating and taking it off. Schools are going to be a disaster, so again, a lot of places have opted for virtual only, but not everywhere has, and there's been a lot of whisperings from the federal government that if a district decides or states decide to officially close schools, that they will have funding withheld from them, which is just maddening, enraging, really a better term, because that is wildly the wrong direction we should be going in, okay? So schools in particular, you cannot trust young kids to keep masks on. They're uncomfortable. That is a fact. They're not going to kill you, you're not going to get hypoxic, you're not going to die from wearing it unless you have other conditions going on, but a regular, healthy 10-year-old is not going to die from wearing a mask. However, it's uncomfortable. All day long, outside, in and out of stuff, it's getting shoved around, the nose is getting pulled out. Be realistic about this. It's not feasible. And the discussion around the susceptibility of children is very questionable to me, because we closed schools down so quickly in the beginning, kids were less likely to be in a situation where they would be exposed to the virus, but when we reopen, that's not going to be the same. So the predictions of, only like between 6,000 and 15,000 kids are going to die, as if that already wasn't bad enough, those numbers are probably going to be higher. Additionally, the fact that it's not just the mortality rate of the disease itself, okay? It's not just about how many people in a perfect situation will naturally succumb to the virus. It's about the healthcare system's capacity. And we are at capacity again in a lot of places. So I live in the southeastern US, and we're already at the point where hospitals are full, ICUs are full, we're running out of ventilators. It's bad, and that's when we start delving into some really seedy eugenics, where we pick and choose who lives and dies based on who gets the resources we have available to us. And they claim that that's not eugenics, and they're not going to make decisions based on who's disabled or this or that, but they are, and they have been, and that's exactly what's happening, and that's exactly what will continue to happen. So we really don't want that, and the only way to avoid it is to pay folks to stay home, okay? That's our only option right now. And it's scary. So COVID-19, again, it causes multi-system organ failure is really what's going on, especially in the severe cases, but even in the mild cases. Folks are coming back with lung damage. So, and the other thing is that the recovery time is much longer than people are really saying. So you might be done with the actual virus in a month, but you will be recovering from that organ damage for many months. And again, because the antibody resistance wears off, the antibodies wear off or fade to undetectable levels within 2 months or less, so a lot of folks that are still recovering from organ damage from the first infection are susceptible to a second infection. Okay, really, really bad stuff going on there. We really do not want to mess with that, and I am beside myself that we have to have this conversation over and over again, because it seems so clear-cut that there's an uncontrolled, uncontained pandemic tearing through our population, and the only tools in our tool chest are essentially social distancing. Stay away. So we gotta close stuff down. We gotta make it possible to avoid each other. And I know we also need to talk about the psychological effects of isolation. That's important. That matters too. However, those things can be dealt with easier than allowing millions of people to die from this virus if we don't contain it. And I can't stress enough how exponentially worse it's going to get if we let schools open for in-person classes. Okay, that is just going to be such a catastrophe. And on the one hand, yeah, we're going to have a lot of dead kids, we're going to have a lot of dead teachers, we're going to have a lot of dead admin staff and janitors and counselors and kitchen staff, etc. But you're also going to see strikes and walkouts. So a lot of teachers that have the means, that have the capacity to be unemployed for a while, they're not going to walk to their death. No, they're not. That's not going to happen. They're going to strike, or they're going to quit. So you're going to get a mass walkout of teachers. So at a time when we need the most resources, we're going to end up with the least. So we're setting ourselves up for failure there, and I would like to abandon that ship before we get on it. So if you were a teacher, or you have a kid in school, I really recommend putting some immense pressure on your school board, because this is seriously an issue of life or death. And it's more than life or death. Survivors are coming away with long-term organ damage that might be irreparable. Some survivors are actually dying after the fact from the organ damage. So, again, the flu does not cause organ damage. The flu is not going to give you a stroke. The flu is not going to give you blood clots. So I am begging you to stop comparing COVID-19 to the flu. It's not similar. It's not related. And it is a really devious misinformation campaign to trick folks into thinking that it's fine. So a lot of folks out here that are claiming that it's a hoax are doing so because a lot of officials whose job it was to guide them in the right direction have really pushed this narrative that it's not that big of a deal, it's not really happening, no one's really dying from it. But if you talk to healthcare workers or anybody that's actually had it before, you hear a very different story. So there's lots of blame to go around. Again, the anti-mask movement is... I don't even have words, to be perfectly honest. I really thought that this was going to be the one thing that nobody complained about, okay? So it's not like it's the least invasive measure you can possibly do. No one's coming into your house, no one's injecting you with anything, no one's pushing you to the ground and forcing you to accept some sort of bizarre treatment. They're asking you to put a very thin strip of cloth over your nose and mouth while you were in public. Okay, I am beside myself. I'm on, at this point, I'm wondering, did seatbelts have this kind of pushback? Did people panic about airbags? Like, I don't understand how this has become so politicized. This issue of public health that the entire rest of the world was able to band together and deal with, the United States is treating as a partisan issue. So that is just a microcosm of the many, many, many things wrong with the United States, but that's a side note. The big takeaways for this video are COVID-19 is not the flu. COVID-19 is a vascular disease that attacks the capillaries in your organs and causes widespread organ failure. So, big problem there. And again, there is no guarantee that getting it protects you from a second infection. We are a year at least away from a vaccine if a vaccine ends up being possible. The only treatment that I've seen that has shown any promise, and I apologize, I'm going to say the word wrong, it's remdesivir. A lot of those letters are right. But that has shown some promise as a therapeutic drug. However, it has been price gouged to hell, and no one can afford that. So the other thing is some survivors are coming away in America and the US with like $1 million hospital bills. They survived COVID, who knows how much organ damage they may have come away with, but now they're going to go into medical bankruptcy. So, again, the takeaway here is you don't want to get it, and you don't want to pass it to somebody else. So, wear a mask. Put pressure on your city governments and your school boards to close things down. It is our only option, and barring that, we need a general strike. And I know that's terrifying, and I am not an organizer. A lot goes into a strike, and I recognize that, but this is not the same as like an Amazon strike, where you're striking for very specific means to change the order of events in this particular business. This is a survival mechanism. This is, you're being walked off the plank, and your choice is to jump into shark-infested waters or sit your ass down and say, no, we're not doing this. And if all of us do that at the same time, imagine if every teacher refused to go to work, if every counselor refused to go to work, if every clerk and busboy and city officer, I mean, if everyone at one city official, sat down and said no, there's very little they could do to coerce us. And we've seen that work before. But it's hard, and it's scary, and everyone right now I know is pushed between a rock and a hard place because there's been such a disjointed response to COVID-19, and people are saying, you know, your state's open, go back to work, but at the same time it's not safe to necessarily go back to work, but bills are piling up. It's really a travesty. It's another example of one of the many ways that the U.S. is a failed state, but I digress. Again, the big thing is masks are very important, and I can't stress enough how necessary it is to wear them, but I also can't stress enough how necessary it is to minimize the amount of time that we have to. Because, and everyone has seen this, the longer someone's in a mask, also especially if they're outside in the summer heat, the shorter time it takes before they start pushing their nose out. And again, if you haven't had to wear a mask outside for an hour, go do it. You might be fine. It might be easy for you. I can say that it's difficult for me. I have a lot of sensory issues, and I've done it, and I will do it, and I understand the necessity of it, and I am capable of forcing myself to endure discomfort. But here's the thing. Some folks are not capable of forcing themselves to endure discomfort, and some folks do not understand the necessity of it. So in places like Six Flags or Disney World, you're going to get folks that wear the mask because it's required for entry, and the very second someone's not looking at them, that mask is coming off or getting slipped down or getting shuffled around because they're wearing it out of obligation, not out of a sense of civic responsibility. So that's another big thing. If we're not on the same page about why we're doing these things, we're not going to have a cohesive effort about them. And masks, again, work real well if you use them correctly. If you don't use them correctly, they don't work at all. So, wear a mask, but minimize your outdoor time. I think those are the biggest takeaways for me for COVID is A, the symptoms are worse than you think. You're susceptible whether you're young or old. The hospitalizations right now, in my state in particular, are centered around young folks. The people getting hospitalized are between like 20 and 40. They're not the folks dying, but they are getting serious cases, and there's a good chance they're coming away with organ damage. So don't assume because you're young and healthy, you're safe. Don't assume because you had it once that you're safe, especially if you had it early on. So if you got COVID back in, March, there's a good chance you had an early strain, and every time this beast mutates, it gets worse and worse and worse and worse and worse. So there's some debate about whether or not the early iterations were actually a vascular disease, or if it really did start as just a respiratory disease, but it has mutated, and it is terrifying now. So stay home, stay safe, stay masked, and demand a society that takes care of its people.